When 85% plus of my patients have improvement in their health after explanting, you know it's real. We need further studies to determine the root cause. And I think, doctors doing a lot of explants and are really working on this along with the medical community. It's becoming more recognized amongst my peers and colleagues, even in other subspecialties, that are referring patients when they see their patients improving also.
What are the most common symptoms of breast implant illness, and how can women differentiate these symptoms from like any other health condition?
Well, there's a tremendous amount of symptoms that I see in my practice. The FDA has finally come around and recognized breast implant illness and even have it on their website. And they list the most common symptoms as brain fog, anxiety, joint pain, skin rashes. But really, I see a lot of GI issues, exacerbation of autoimmune issues. You name it, I've seen it. It's, again, not something we can diagnose through blood work or other types of studies. And having your implants removed, it is a leap of faith. But lo and behold, in my practice, I see most of my patients improving in their health.
And that's exactly what you're all about. And I love that about you. What does current research indicate about the potential link between breast implants and cancer, such as BII, ALCL, or other cancers?
Well, we know it's a correlation and a connection, particularly more with textured implants than with smooth implants. The BII-ALCL, which you mentioned, and also we see a squamous cell carcinoma, which is a cancer within the scar tissue or shell. It is very rare, but it has a higher mortality and morbidity than the BII-ALCL. So that's something that we're studying now as well.
Can you explain the differences between silicone and saline implants in relation to the connection to BII and cancer risk? Are there specific materials that are more concerning?
Well, silicone and saline implants both have a silicone outer shell, and that shell traditionally is either a smooth surface or a textured surface. The texturing was made to try and reduce capsular contracture or hardening of the shell around the implant. We've seen more issues with the textured implants than with the smooth. However, there's concerns with both. Enough of an issue that the FDA took off the Allergan textured implants from the market a few years back now. So we know there's concern more with the texture, but both implants, particularly with BII, can cause symptoms. It's just with the cancer diagnosis, the textured we see more commonly.
Yeah, I was reading up on it. Silicone and saline implants have distinct characteristics that influence their risk profiles, but silicone is often praised for this natural feel, but it is more commonly associated with inflammatory responses, which raises questions about its safety compared to saline. But you can't dismiss the saline because I had saline and mold was growing around the valve, right? So like, you just don't know. And the research is still not potent enough for us to draw conclusions. Now, for women who want additional volume, but prefer to just avoid implants altogether, what options do you offer, and how effective are they in achieving these natural looking results? So to say, I know it's not going to be how it was before, but what do you recommend?
Really, the best thing we have is fat grafting. So it's traditional liposuction. We collect it in a specialized mechanism made for fat grafting. It's injected into the breast. The nice thing about it is it's your tissue. It's not a foreign body. The downsides really are it doesn't give a complete implant look. Really, we can increase breast volume by maybe a half cup to a full cup per procedure. So some women have to have it repeated, but it's the best thing for long-term volume increase without using, a device that's foreign to your body.
Yeah, minimizing long-term risks. That's what it's all about. Now, how has social media influenced the rise of awareness around BII and the demand for explant surgery?
It's been fantastic because it's an educational tool, and a lot of these sites are women speaking to other women and giving their experiences. It's bringing light to the fact that this even exists, because it's been kind of like we talked about, poo-pooed by the medical community for a long time and brushed aside, and these patients have not had a voice. They haven't been aware that their implants can be causing some of the debilitating symptoms they're having within their life. So I think social media has done a tremendous job in educating women and the public in general that this could be a possibility.